Welcome, welcome, welcome back, my Be Health Empowered family, for another week of Excuse Me, Doctor. I am Dr. Melissa Clark. Please call me Dr. Mel. I am always happy to be here with you every Monday, bringing you all the information that you need to be empowered when it comes to making wise health decisions for yourself, for your family, and even for your community. So, we're right here on YouTube, we're on Facebook. And if you are new and joining us for the first time, please hit like on Facebook and subscribe, that red button on YouTube. I really appreciate you for it. And if you are part of my Be Health Empowered family already and you haven't done it, I am especially asking you all to do it. So thank you so much. And also remember, put your questions in the chat because that's what we're here for. We are here to make sure that you get your questions about your health information answered. So now let us get into creating that amazing week for ourselves that we always do with all the health topics we're going to cover tonight. And to do that, you know what I got to do? I have to bring in Mr. Wayne Bruce, my co-host, my producer.
That's right. Bring
That's right.
me in.
Right. So you can be the voice in the studio for the audience, bringing in their questions, bringing in their comments.
I know.
You're the man.
This is really funny. This is really funny. I just talked to our guests in our green room and I told them to look into the camera, right?
Uh-huh.
And the first thing I did was look at a computer screen. I did it
See?
wrong, Dr. Mel. I was
Well,
wrong. That's
see?
what I get for being like Tyrone, Terry, Tony, Taylor,
And Tanisha.
Tanisha, and all the other Twitter finger family. I was like them. I had it wrong. And then I say we were going to have some technical difficulties. Look, this has been a technical difficulty broadcast. I think Mercury is in retrograde. I think Dr. Mel is going to have to sign out and sign back in. Oh, she's back. She's back, y'all. Dr. Mel is back. No, she isn't. See, that's what I get. Look, we have an incredible show planned for you today. And she'll be back shortly. I'm bringing Dr. Mel in, but don't tell her she was off camera. She hates that. We're not going to tell her. We're not going to tell Dr. Mel she was off.
I am back though.
But she's
And it
back.
must have been because you looked not at the camera. That just threw everything off.
It just threw everything off. It
Right,
just threw it.
exactly.
People really want to hear from me, the voice of the street,
Is that what
the
it is?
person
Or
who
did
does
you just
not know. I don't know
did
what's
you
going
just
on.
cut me out so that you could just take over? I
Just
don't
want to
know.
take over, Dr. Mel. That's what I do. That's what I do. I take over.
I know. Well, you do a great job of it, but we have a show to do tonight.
So look, I'm
So
excited. I'm excited because I don't know if I told you this, Dr. Mel. Look, when I was growing up, I lived in a house with my grandmother and my great aunt and uncle. And y'all
wow.
don't laugh because my great uncle's name was Uncle Tom. All right.
What?
His name was Uncle
And
Tom.
but it wasn't a cabin.
Well, no, I was getting ready to curse, and we cannot curse. We did not live in a cabin, but it was Uncle
Okay.
Tom, and his wife was my grandmother's sister, and
Okay.
her name was Aunt Georgie or Georgia. Her name was Georgia,
Mhm.
and then my grandmother. And our topic today really is a family topic because in our community we've
Mhm.
seen this so many times. I grew up in a household with my grandmother and my great aunt. They were diabetics.
Wow.
Or
So
hold on,
yeah,
they had sugar. They
they had
had
sugar.
sugar.
Right. I mean, that's what we hear sugar diabetes, high sugar. There are a lot of names for it. And thank you for sharing that
Mhm.
because no matter what you call it, type 2 diabetes is a disease as common in Americans, but especially in the black and brown community. And it's not uncommon, like you said, to see it in families. a lot of people don't understand that just because my parents had it doesn't mean that I have to have it too, even though we're going to hear from our specialist, our endocrinologist, about what role genetics plays, but a lot of it though is lifestyle. So we're going to talk about that. We're going to talk about what a diagnosis of diabetes means and what you need to know to be empowered in managing diabetes for you or your loved one. So it's going to be a good show. I hope everybody shares it. Share it with those who you know who have diabetes, even if it's somebody who's had it for a while.
Right.
And stay tuned. Keep it locked.
Keep it locked. Keep it locked here. And my good friend of the show, Tracy Wall, says, "Get it right. It's the sugar."
Oh, my bad.
It's the sugar.
Thank you, Tracy. Thank you for clearing that up.
So we're going to get to that. But before we get to that, you know what we have to go to? We have to go to recap everything that's happening in the world of medical America.
Right. And health and wellness. Absolutely.
Health and wellness. I mean, I'll leave that for you to say, the health and wellness part, man.
Well, let's jump into it.
Hey, give us an update on COVID.
Yes, absolutely. Last week I said we were in a BA.5 wave. Well, that wave is on its way to becoming a tsunami. I talk about wastewater and how you can monitor the cases based upon how much COVID is in our wastewater, because if we have a COVID infection, it first gets eliminated in our stool before we even have symptoms. So those wastewater numbers are looking just like the wastewater numbers did back in December with the first Omicron wave. And we know what that looked like.
Yes.
So don't be fooled by the fact that you're not seeing a lot of cases reported because people are home testing and they're not, reporting it necessarily. But we know hospitalizations are going up. We're past about 6,000 new people being admitted to the hospital each day. Thankfully, the rate of death from COVID is hanging in there at about 300 to 400 people a day. Still too much, but compared to the number of cases that are out there, that's actually doing much, much better than we have in the past. And then there's some vaccination news.
Hey, what's the deal? I heard this is a new one. When can I go get it?
Well, the Novavax vaccine has gotten FDA approval. This is huge because it may, allay the concerns of those people that are concerned about genetic material being in the DNA and messenger RNA being in the vaccine, because the Novavax vaccine does not have genetic material; it just has the viral protein of the spike protein of the coronavirus. And so some people may feel a little bit more comfortable because that's more like, your traditional type vaccines, even though there's really no concern about the quote unquote genetic material.
I know, but they said with this vaccine that it covers Omicron.
Well, actually, so that's not quite. They're working on an updated version of the Novavax for this fall that will cover all the Omicron variants. But when they tested it on 26,000 adults in the United States and Mexico, and it showed an efficacy rate of about 90% against preventing you from getting symptoms of COVID. But it was tested a little bit earlier than the present variant. So they're still working to refine it. And it was actually tested at least one or two of the HBCUs that have medical schools. Howard University, I know, was one site for the Novavax vaccine trial.
Whoop, whoop. Howard, come on, get it on.
Yep. HU.
you know. Okay, now look, we've gone through that. The second scariest thing in America, as far as health and wellness, is the darn monkeypox.
Right.
What's the deal?
Well, we talked about it last week. The new thing since last week is the WHO has declared monkeypox a global health emergency, which means that A coordinated international response is needed because there are some hot spots around the globe. Europe, Africa is one of them, certain African countries. Europe is actually now the epicenter of the outbreak, and the threat is highest there. Still, though, it does appear that men who have sex with men tend to be those who are transmitting, passing monkeypox to each other. That's the case in Europe. It's the case here in the United States, and there have been no fatalities in the United States or Europe, but there have been 73 fatalities in the African countries that I mentioned. You can take steps to protect yourself by getting vaccinated, because there are vaccines available, mainly for the high risk groups that I mentioned, men who have sex with men, but also you can protect yourself by avoiding close skin to skin contact with somebody who has the monkeypox sores. So it starts off with fever, and then sort of malaise, sort of, feeling a little run down. And then you start to see these sores pop up on your body. So avoid people that have the sores. If you're thinking about having a sexual contact, inspect yourself and make sure that your partner has inspected themselves, to make sure that you're not contagious, that neither of you are contagious.
And y'all don't need to have close bodily contact with people with sores. I'm just saying.
Well, yeah, well,
Not
that's good. That's good advice in general. Yeah.
I'm just covering
Yeah.
the field here. Everybody. I mean,
Yeah.
if you see a sore, say no. That's gonna be the motto. You see a sore, say
That's
no.
Wayne Bruce's advice.
That's
Thank you very much.
I might put it on a shirt. See a sore, say no.
So if you see a T-shirt circulating out there, you know where it came from.
See a sore, say no. Look,
All right.
so we had to move on. The pandemic has brought many things to us. Unfortunately, it's brought people going into the liquor cabinet a lot.
Yeah.
All right.
The mental health stressors around the pandemic have caused a surge in alcohol use. Sales went up 50%, usage went up 75%. Women's alcohol intake went up more than men's. So that's almost
Wow.
equal to men's now.
Mm-hmm.
And excess alcohol consumption, which is defined as 8 glasses per week for women, 15 glasses for men, can affect your heart and liver function, your digestive function, your blood pressure, your sleep quality, risk for certain cancers, especially breast cancer. A lot of women don't know that, as well as your overall mental health. So, if alcohol is interfering with your relationships, your work, or your health in any way, it's time to talk with your doctor about treatments to lessen or stop drinking. Even reducing your weekly drinking can have significant positive health effects.
Yes. I mean, and if you're going through anything, remember we have a hotline now, right, Dr. Mel?
Right. Yes, absolutely. The 988 hotline. It was the new mental health and substance use hotline that was rolled out just last week. So you can just call 988 and talk to a counselor. They'll help you find mental health resources in your area, as well as substance use disorder resources, which would include those for quitting alcohol.
Okay, thank you. So the next subject is near and dear to my heart, or near and dear to my waistline. Uh, everybody's looking at their phones now, and
Yeah.
it's not a great thing for your health.
And they're not jogging and looking at their phone, or
Not
walking and looking
jogging
at
and
their
looking at
phone.
it. They sitting in chairs eating chicken and, and cupcakes.
Yeah, yeah, unfortunately. And so smartphones, tablets, they appear to induce compulsive or even addictive use for many people. And this looks like it's correlated with problems with your health. So each hour of screen time a day was found to translate over time into a BMI, or body mass index, increase of 4 pounds per foot. A lot. So, with this type of progressive rise in BMI comes what we're going to talk about tonight: prediabetes and diabetes, cholesterol problems, heart disease. So, in addition, screen time also disturbs sleep, which brings, when you use your devices close to bedtime, that brings its own problems of disrupted sleep and what that brings in terms of fatigue and increased eating the next day to keep your energy up. So yeah, cut down on that screen time. They have the little hours. I get dismayed when I look at mine. It gives me the little alert. Your screen time increased by 25% since last week. So yeah,
Oh,
you can monitor it and
is
give
that why I
yourself
cut
alert.
mine off?
I don't know. I
I
don't
turn
know.
off my alerts, and
Yeah.
it's not been well. It's not been great for me. But
Yeah.
I will.
Yeah. We can't hear you. Yeah. So while Wayne is getting that together and talking about his cutting back his alerts on, hopefully, um, let's move on to our last topic, our last recap topic, which is vaping. Is it safer? A lot of people think that vaping or e-cigarettes are a safer alternative to traditional cigarettes, but that is not the case. The physical and mental side effects of vaping can cause more harm than good. If you're currently vaping or considering picking it up, you might want to think twice about that because it comes with its own health risks. So, includes serious heart and lung damage because of the chemicals and the heavy metals. It might even be more addictive than traditional smoking. It has nicotine that can cause anxiety and sleep problems. And unfortunately, young people, which is the fastest growing group of vapors, are at higher risk for addiction. So if you don't smoke, don't start vaping. It's not the safe alternative that people say.
I was recently at a restaurant. Walked by a restaurant, famous restaurant here in the Washington D.C. area, Ben's Chili Bowl. I just walked
Uh-huh.
by because I know the owner.
Shout out to Ben's.
Shout out to Ben's Chili Bowl, and and I noticed all the young people who were just vaping. I just noticed that
Yeah.
it was very interesting. So
It's the
we
cool thing to do.
uh,
Yeah.
is it very cool to do? Gotta watch
Not for
that.
your health, it's not. Yeah.
Gotta watch that. Gotta watch that. So that leads us to what's next, Dr. Mel?
I believe it's debunk time.
The weekly debunk. Stopping misinformation in its tracks.
So Tony, Tony Twitterfingers, who was vaccinated, said, I'm not getting a booster. I ain't getting boosted. I'm just gonna wait until the fall when the new booster comes out. Why do it now anyway?
Well, well,
I said, I don't know about that. Excuse me, Dr. Mel. Is that true?
well, this is the deal. Don't sleep on your booster. Um, most Americans are under vaccinated. Less than half are up to date on their first booster, and less than 1 in 3 who are eligible have gotten their second booster. If you're over 50 and you have not had a COVID-19 vaccine yet this year, run, don't walk to get it. Talk with your doctor if you have any questions or concerns, but definitely get boosted now because, like I said, we're in this new wave um, of BA5. So people who are double boosted are 42 times less likely to die from COVID than those who are unvaccinated. People who've had one booster are 4 times more likely to die from COVID than those who've had two boosters for the people who are eligible. So COVID can vaccinations do two things. They can protect you from catching COVID, which we're seeing with these new variants. The efficacy has gone down, but they also lessen the effects of the virus if you contract it. And we're seeing huge differences between people who are boosted and versus those who are not in the way that they respond to BA5. So the other thing too is the more times you've had COVID, the more risk you have of developing long COVID. That's definitely not what you want. And it's sort of Russian roulette as to who might get long COVID. So
Yes.
get that booster now. It's the better way to go.
All right. And there you heard it.
All right. Well, thank you, Wayne. We will see you back a little bit later because we are about to jump into our show for tonight. And we're going to talk about diabetes, understanding a diabetes diagnosis. We know that people of color in the United States, Black people, Native Americans, and Hispanics especially, are at least twice as likely to develop type 2 diabetes as compared to whites. And that's related to a number of environmental, social, and economic factors. Importantly, though, people who are at risk for diabetes often don't know they have the disease. That places their health in jeopardy. And then if they get diagnosed, they often don't get the support they need, or they don't have the resources or the understanding to manage the condition successfully. So that's why we have our incredible guest with us tonight. Our first guest is Dr. Gail Nunlee-Bland. She is an endocrinologist, diabetes expert, faculty at Howard University College of Medicine, and director of the Howard University Hospital Diabetes Treatment Center. Thank you so much, Dr. Nunlee-Bland, for joining us.
Thank you, Dr. Clark. It's my pleasure.
Absolutely. And then we also have Miss Lisa Gaunt. She is an IT project manager by day, life enthusiast all the time, and she's been living with diabetes, which has made her a diabetes warrior. We are so happy to have her on the show tonight. Hi, Lisa.
Hi, Dr. Mel. Thank you so much for having me.
Absolutely. Well, let's jump right into it because we have a lot to cover. I'm going to start with you, Dr. Nunlee-Bland. What is diabetes type 2, and is it the only kind of diabetes there is?
Well, diabetes type 2 is a disorder where your body does not handle the blood sugar, the food that you eat, and it's related to insulin. Insulin is a hormone that's generally produced by the pancreas, which is an organ behind the stomach. And people with type 2 diabetes generally do not have enough insulin, or the insulin that they do produce, sometimes they have more than enough. The body just doesn't recognize it. And when insulin is not being produced or it is not being recognized, that leads to your blood sugars going up because insulin is important in taking that food that gets converted to blood sugars into the cells so that your cells can survive. So when you do not have enough insulin or your insulin is not working very well, that blood sugar goes up into your bloodstream, then it comes out in your kidneys, and that causes you to urinate more, then you're thirsty, you drink more, your cells are starving, you're losing weight despite you may be eating, then you become tired. And these are some of those symptoms that generally people with diabetes have when they're diagnosed. Now, your second question is there any other types of diabetes? And there
Right.
is one, type 1 diabetes. And this type of diabetes is when your body absolutely does not produce insulin. And the only way that we can treat this is by giving insulin injections, as compared to type 2 diabetes, where you may be able to take pills. Everyone needs to do diet and exercise, whether you have type 1 or type 2. But there are
Mhm.
other medications that can be used to treat type 2 diabetes.
Great. And in the beginning of the show, Wayne talked about his family, and we brought up the issue of, if your parents have diabetes or one of your parents, does that mean you're definitely going to get diabetes yourself, meaning type 2 diabetes?
Well, you don't necessarily have to develop type 2 diabetes if you have a parent that has diabetes. We know that diabetes can be prevented or at least prolonged where you do not develop it at a very early age. And one of the landmark studies revealed that if you have prediabetes, and this is the diabetes where it has not really gone into full-blown diabetes, you, by exercising, reducing the amount of food that you eat, and by exercising, we recommend 30 minutes, 5 days a week, or 150 minutes a week of exercising, and just reducing your calories down by 500. Not to say that you eat 500 calories a day, but you can not drink that large soda and a bag of chips every day, and that would be enough to reduce the amount of calories that you're consuming for that day. And that helps to prevent diabetes. And they show that doing those two things significantly reduce the individual's chances of developing diabetes, even if you have a strong family history of diabetes.
So that brings us to Lisa, because I know you have a story related to your family and
Yes.
related to how you first got diagnosed with diabetes. So can you share that with us?
Sure. I was diagnosed 5 years ago at the age of 50. I was an exercise enthusiast. I was in the best shape I had been in a very long time, logging upwards of 20, 26, 30 miles, running and walking every week, eating fairly well. And I went to a regular endocrinologist appointment and for my thyroid. And at the end of that appointment, my doctor mentioned that we needed to talk about my blood sugar and that my blood sugar was high. Complete surprise to me because I thought I was doing everything right. And long story short, I got my blood work done again the next day. The urgency in her face and the fact that she was trying to schedule an appointment for me for the next day, which was a Saturday, helped me understand that there was some urgency. And it came back high again. And my next visit, I literally had to go on 4 shots of insulin per day and pricking my fingers to check my glucose up to 10 times a day. And in retrospect, there were signs that I missed. I was drinking a lot of water because I was working out a lot. And so I was urinating a lot, but I associated it with all of the water I was drinking. Also, my mother had the same thing, and she kept telling me, Lisa, I was diagnosed with something similar, at around the same age. But in my mind, unfortunately, I associated diabetes with being overweight. It didn't make sense to me. And finally, it clicked. And my doctor did say that there were perhaps some genetics involved.
Right. So it's some of both, but usually, as Dr. Bland was saying, it is associated more with the lifestyle choices. But that shows you that everybody needs to sort of be up on their health and know their numbers and get their checkups. So it's a good thing that you were doing that. So, Dr. Bland, what is hemoglobin A1C, and how does it relate to this whole keeping up with your numbers when it comes to diabetes?
Well, your hemoglobin A1C is a blood test that we measure, and it tells us what your average blood sugar has been over the last 3 months. And so this is a useful tool for us to assess if your diabetes is under control. Ideally, we would like for your hemoglobin A1C to be less than 7, and even better, less than 6.5. But we don't want to just harp on A1C because there are other confounding factors. If you happen to be very frail or very ill, or you're more prone to having very low blood sugars, we may relax that somewhat. And it may be okay to have an A1C of less than 8.5. So it all depends. So we try to individualize our treatments and goals for our patients in terms of what their ideal A1C should be.
Right. So you really work with the individual patient, what their overall health is, in setting what that A1C should be. Um, and so, can you also tell us what are some of the complications of diabetes? Why do you want to keep it under, quote unquote, keep it under control and really monitor those A1C numbers?
So I always like to think of it as the ABCs. A1C is one of the tools that we measure and we look at to determine how to prevent certain complications. And the A1C, or your blood sugar control, is important in terms of preventing the eye damage, or what we call retinopathy, the kidney problems, what we call nephropathy, and the amputations, in terms of neuropathy. And so we know that with blood sugar control that we can significantly decrease those complications. So that's why it's so important to look at how well your blood sugars are controlled, looking at that A1C. Now, the B, blood pressure, because we also know that diabetes is associated with heart disease, cardiovascular disease. So we also try to control the blood pressure because that is a complication of diabetes. And in fact, heart disease is one of the leading causes of death in people, particularly with type 2 diabetes. And the C stands for cholesterol. So we also want to control that as well. Medications to make sure that the bad cholesterol is below 100, or even if you have heart disease, it may need to be below 70. We'd like for your good cholesterol to be good, which is that HDL, which helps with exercise. And then the fat, the triglycerides, which is the fat in the blood, we'd like for that to be less than 150. So we treat the cholesterol with medications. We treat the blood pressure with blood pressure pills. And so we always look at that A, B, C, A1C, blood pressure, and cholesterol to prevent the complications associated with diabetes.
I love that. Keeping it simple, ABC. So, Lisa, you post a lot on Facebook. That was actually how I knew to reach out to you regarding your health journey. And you always post your meals and you talk about your meals. So, tell us some of the things you post and why you started posting.
Wow. I just try to be transparent. I always think that if there's something that I'm doing, particularly that is challenging, maybe if I'm transparent, it will make it easier for someone else. So that's kind of the whole pretense behind why I post what I post. And I'll tell you that I learned that a lot of people I know are diabetics and weren't really comfortable with that being publicly known, which even further pushed me to be transparent. So it's really to be helpful. Also, I enjoy eating, and nowadays you don't have to sacrifice good food or good tasting food in order to eat well and maintain your diabetes. And so I'm just trying to get that message across as best I can for the people that I know and beyond. It doesn't have to be as bad as we sometimes make it. I'm not saying it's a great thing. I'd rather not have it, but we can make it manageable.
Great. I love that attitude. And some of the things you post look incredibly delicious, by the way. But I know I can look at them and tell that they're very healthy and they're diabetic friendly, and that you're keeping on top of your health. And so, Dr. Bland, can you tell us what are some of the misconceptions about diabetes? Maybe the top 3 that your patients have that you often have to help to clarify for them.
Well, I would say the number one that I hear is, oh, if I start insulin, I remember my mother, she died right after that, or she went on dialysis right after they started insulin. So I'm not going on insulin. And that is a misconception. Most likely, the reason why they went on dialysis was because they were out of control, probably for several years. And maybe if insulin had been started earlier, that could have been prevented. The second misconception, and I'm glad you mentioned that, Lisa, I can't eat any of the foods that I enjoy. I don't want to see the dietitian because she's going to keep me from eating those foods that I enjoy. And that's a misconception, and that you can eat foods in moderation, preparing them in a healthy way. So that's a misconception. And I do struggle with a lot of our patients really working with someone who can help them learn how to eat with the foods they like to eat, but within moderation. And then the third misconception is, and it probably is more so with injections and weight gain. Those are things that Many of the, particularly the women who are concerned about their weight, and with your blood sugars are all out of control, you're losing weight, but that's not good for your health. So really just trying to get those blood sugars under control. If we do have to give you insulin injections, you may gain weight. But I'd like to also mention that we have some really great medications out here that really helps not only control your blood sugars, but also help you lose weight as well. So that has really motivated many of my patients to get their diabetes under better control.
Mm-hmm. That's excellent. And we've talked about medications. Are there lifestyle changes that could eventually lead to requiring less medication in the management of diabetes?
Definitely so. I had a gentleman who came to our office, I guess about 6 months ago. His A1C had gone up, and he said, "No, I really don't want to start medication at this time. I'm going to work really hard in terms of improving my lifestyle." So he started exercising. He ate healthier, and we were able to manage him with just diet and exercise. So it can be done. He lost about 10 pounds through his lifestyle change. So this can be done. So I encourage all patients with diabetes to really, lifestyle is so important. The diet and the exercise is one of the best ways to control your diabetes. I often tease them. I said, you can out eat any medication I give you. So I really, really encourage you to really try to work on your diet and your exercise, because it can improve your overall control.
Right. And we talked about monitoring your blood sugars. Lisa, tell me how things have changed for you, how technology has kind of helped you not have to do those 10 finger sticks a day, which
Yes,
I know sounded probably daunting to a lot of people.
oh my goodness. And it was daunting to me as well. And one thing I would like to add, echoing what the doctor has said, I mentioned that I went on 4 shots per day, and I kept exercising. As the doctor said, my doctor said, don't stop exercising. Within 3 months, I was able to go from 4 shots per day to 1 shot per week. And so
Wow.
hopefully that
That's
resonates
huge.
with someone out there. It works, it can happen. But I use the Freestyle Libre to monitor my glucose. So I have the monitor in my arm, and I can scan it with my phone, and I use it all of the time. I honestly only have to check it in the morning and at night, but because I work out and sometimes it's on the go, traveling, what have you, for work, I feel more comfortable having the Freestyle Libre. And what I like about it is that you can literally see when you're exercising, your glucose levels go down. You can see when you eat what types of things exactly make your blood sugar skyrocket. And so I like having that readily available to me. It kind of helps me keep myself in check.
Thank you for mentioning that. It strikes me, I read a quote that, basically being sick takes work and being healthy takes work, right? So the better thing is to put the effort into being healthy. But it takes a certain sort of mental attitude, I think, to do that. What role would you say paying attention to mental health plays in the management of diabetes? And that's for either of you.
Well, I know I'll let Lisa go since she's
No, doctor, please.
Okay. Well, one of the things that we do in the Diabetes Center, we have our diabetes educators, and they go over the mental health, the behavioral issues that come along with diabetes. I mean, it is tough. It's a 24/7 condition. And so what stressors that come with diabetes, what your family, how do they interact, going out in society or telling your coworkers and your friends that you have diabetes. These are things that put a lot of stress on individuals. So we really try to work with them. How do you manage yourself in these stressful situations? Because stress in itself can cause your blood sugars to go up as well. So our educators work closely with them in terms of managing the behavioral, the stress, the ongoing management that occurs with diabetes.
Excellent. And you also mentioned diabetes educators. Who else might be on your team if you are a person who has diabetes? What other members of the healthcare team might you be interacting with?
Well, we have our medical nutritionist who works with them with the diet, as I mentioned before, customizing the diet to their own liking. We have we have a pharmacist on our team as well who works with them with their medications, and we work together as a team so that we can work closely with one another. We also screen individuals for what we call diabetes distress, a screening tool. And if we notice that they are having a lot of stressors regarding their diabetes, if it's something that our educators cannot handle, then we can refer them to mental health professionals for further evaluation and treatment.
Wonderful. Well, it sounds certainly like that comprehensive approach would really be helpful to address some of the stressors. I have a ton of questions, but it's time to stop and bring in the audience to see what they might have on their minds. I encourage you to, if you haven't yet, put your questions and comments in the chat because we have Wayne back to let us know what some of those are.
Incredible discussion and a lot of information, Dr. Bland and Lisa. We thank you. Audience is thanking you just for your journey, for your journey. So we have a question. I'm going to combine two questions here. A question from, if I could go back, from Marvin Warfield, and a question from Valerie Spalding Parker. And Marvin asked, where is it? Here we go. Marvin asks, does a person with type 2 diabetes need a continuous glucose monitor? And the second question is, has continuous glucose monitoring really helped in maintaining blood sugar control in diabetics?
So we probably should have mentioned that what Lisa mentioned she had, the Freestyle Libre, is a type of continuous glucose monitor. But Dr. Bland, maybe you could just talk to us and maybe directly answer that question.
Yeah.
Okay. The continuous glucose monitor measures your blood glucose every 5 minutes, and they come in basically two forms. Lisa mentioned the Freestyle Libre. Many times you'll see someone wear that little disc on their arm. They can scan it. They can see it on their phone, and you can see your blood sugars throughout the day as long as you scan your that little disc at least every 8 hours to get that continuous reading. We also have another one, which is the Dexcom, which continuously measures your blood glucose, and you can see it on your phone as well. Both of them now give you alerts to let you know when your blood glucose is too high or too low, which is very helpful. And so this, I have determined that it really helps many of our patients to improve their diabetes control. We've seen significant drops in their A1Cs when they use this. Now, for type 2 diabetes, depending on your insurance plan, they generally will not cover it unless you're on 3 or more injections a day, which, I think is not great. I think everybody should get a continuous glucose monitor if they want it. But this is one of the rules that particularly Medicare has. So this is something that really is a challenge for some people with type 2 diabetes. But if you are on insulin injections, 3 or more injections a day, generally most insurance companies cover it, including Medicaid. So, and we try to put, just if we can, all of our patients on continuous glucose monitors who want it.
Mhm.
But
So
you
it's
don't
not
need them.
absolutely necessary. It's not absolutely necessary,
Right.
but it's super helpful. I mean,
Right.
the alternative is doing finger sticks, like Lisa
Yeah.
mentioned that she was doing. Yeah.
And if you have type 2 diabetes, you're well controlled. Your A1C is great. You can do a finger stick once, a day, or even once a week if you're well controlled. But definitely, if you have type 2 diabetes, your diabetes is not well controlled, then it's very helpful to get this continuous glucose monitoring. Now, what we also do is, if you don't want to have one all the time, we have what we call the professional continuous glucose monitor. So the nurse puts it on, you wear it for a week. You can't see those numbers. You bring it back, we upload it, and we look at your pattern, and we go over it with you. You keep a food diary so that we can see, what foods did you eat, what times of the day you're having, more problems. And even sometimes what we have found in some individuals, that their blood sugars are dropping down too low and they didn't even know it at night. So this is another option. And all insurance companies cover the professional one that you wear for a week. So you can actually
Good.
get
That's
that.
good to know.
We have a question from Maria Sindos. She says, does diabetes have some purpose in evolution? Is there any relationship with the Middle Passage?
Interesting
Yeah,
question.
that's a very interesting question. So,
Dr. Bland, I'm going to ask you to take that one.
we talk about this thrifty gene, whereas if you were able to conserve and maintain your body fat so you could survive that long passage across the ocean, that individuals who happen to have this, that they are able to gain more weight because they're able to conserve and so forth. Some people have thought that maybe that is what is, maybe the reason why we see more diabetes in, African Americans. I mean, this is just a theory here, but definitely, we know that the increase in diabetes is due to our lifestyles, our sedentary lifestyles, our weight gain. And when you think about it, years ago, hundreds of years ago, when people were farming more agriculture, they were more active. You just didn't see the weight gain and the diabetes at the rates that we see. And you mentioned, Wayne, about screen time. We're sitting in front of the screen, whether it's on your phone, the TV, the computer, and you're eating. And it's just causing weight gain. And then that puts us at risk for developing type 2 diabetes.
Right. And certainly indigenous people also have that, indigenous Americans have the same problem with diabetes. So it's also the stressors, the sedentary lifestyle, the diet, maybe sometimes access to healthy produce, all of those things sort of conspire. The cheapest things to buy when it comes to food are always the unhealthiest things with the high fat and the high sugar. So all that kind of conspires and goes together. Any other questions, Wayne? We can't hear you. We see you.
Again,
There we go.
it's a technical difficulty day, but we're going to push through it. So I wanted to say, the Flaming Hot Cheetos are probably the cheapest thing in the store.
Right.
So you don't have to go for cheap. Stay away from the Flaming Hot Cheetos. I guarantee you, they will not help your A1C or your
Not one
cholesterol.
bit.
So I just want to say, Dr. Bland has been on point, because even we have a friend of the show, Yvonne Smith. She said we cannot eat like we did when we were agricultural society and workers. But we have a question from Cass Burns, not Karen Burns, Cass Burns. And Cass Burns says, what would be a better alternative to metformin? For me, it causes severe bowel issues, and there's so many meds out there.
Well, first, let's, Dr. Bland, if you could take that and maybe put into context what metformin is, and then answer Cass Burns' question. Thanks for that question, Cass.
Okay, metformin is a medication that we commonly use. Is actually one of the first line medications that we use for type 2 diabetes. And it works. We really truly don't understand how it really works, but we think it works in terms of reducing the amount of sugar that comes out of your liver, may improve your own body's insulin sensitivity to improve taking that glucose into the cells. However, some individuals cannot tolerate metformin. Now, what we sometimes do is we give them a long acting or what we call extended release metformin. And sometimes that works in terms of not giving them as much diarrhea or bloating that they may complain of. Now, there are medications that we have available, and we do have these once a week injections that are very good in terms of reducing blood sugars. And this particular medication works in two ways. One, it augments your own insulin production. And two, it reduces the amount of sugar that is put out by your liver. So it works in two different ways. And so it also slows down your gastrointestinal, your GI tract. And so you stay fuller longer, you lose weight, and it also plays a role in terms of your appetite center, so you're not as hungry. So this is another medication. Now, initially, when we do start this particular medication, which we call GLP1 agonist, common names are Trulicity, Ozempic. These are some of the ones that are out here.
All the ones you see on TV.
Right, exactly. You
With
see,
the
almost
song.
every 5 minutes,
Right.
they're talking about these medications. Initially, patients will complain of upset stomach, GI, but I tell them just try to, stay with it. After about a couple of weeks, your body gets used to it, they tolerate it, and they do very well. So I find those particular medications to be very good in terms of controlling diabetes, particularly in the African American population. Before that, we really had some challenges in terms of getting their blood sugars under control. And so now that they have brought these particular medications out, we have a lot more happier patients now. They get their A1Cs down below 7, 6.5. The women have lost 10, 15 pounds. And, they just came out with a new one now that some of them you can lose 20, 25 pounds. So they might put the geriatric surgeons out of business. So, but yeah, we do have some really great medications out here that we can use to help with your diabetes control, prevent the weight gain, and also it has some heart protection, kidney protection. So these are some great drugs out here. So that's something else that you can ask your doctor about.
And I also want to underscore how important it is. I mentioned, members of your healthcare team, but having a doctor like Dr. Bland and an endocrinologist who's a diabetes expert, if you're diagnosed with diabetes, is really important. And if you and like Cass's question, if you're having a problem with a medication, develop that relationship so that you can tell your doctor, give them feedback, because that's the only way they would then know to then try other things. And there are a bunch of other things that could be tried, but you got to keep that constant communication going and the feedback. Don't give up and throw your hands up and say, oh, well, that medication didn't work, they don't know what they're doing, I'm just not going to deal with this. The best thing to do is keep that conversation going with your doctor.
Okay, we have a question from Warren Fisher, and he says, you've mentioned working out. Lisa, what are the things that have brought your A1C into control? What exercises?
Great question.
Oh, I like to walk and run, but most recently during the pandemic, because my schedule allowed, I started roller skating again. I grew up with that being a staple exercise, family exercise. Always wanted to get back to it, and finally had the opportunity during COVID because we're home. So I roller skate 4 or 5 times a week now. And I don't run, and it has been maintaining my weight and everything just the same as logging 30 grueling miles, hard on the body miles a week. So that's where I am for now.
And I can tell you in her Facebook picture, she looks like she's having a lot of fun roller skating. So she's making me think, should I be out there roller skating?
Right. And there's nothing like, helping yourself, keeping your A1C down and having fun.
Right.
Yes.
Right.
So
Well,
it helps.
unfortunately, I'm from the family. You show me a pair of skates and I fall. From that. So we have another question coming from Delisa Smith Carter Gould. That's a lot of names, but I'm just gonna say I'm going to ask your question. And she says Delisa says it's a dumb question, but no question is a dumb question. Just so I'm clear, once you've been diagnosed with diabetes, is it possible to reverse or eliminate it altogether? Or is a diagnosis always lifelong and your only option being to manage it through diet, exercise, and possibly medication?
Excellent question, Delisa. Dr. Bland?
Yeah, I get that question quite a bit. Can I reverse it? And I always tell them you can control it. This is something that if you can go back to eating before you develop diabetes, not being physically active, it will be there. So I don't want to say that you have eliminated it. It's really about control. And everyone should really watch what they eat, exercise, whether you have diabetes or not. So this is something that is a lifestyle that I encourage everyone to participate in.
And I just want to throw in the very last question, which is low carb versus low fat. Because we've talked around, we've said, watch what you eat, but we haven't specifically said. So what would you say in terms of an eating plan to follow, Dr. Bland?
Yeah, that's a great question. And I don't know if we have all of the evidence out there in terms of low carb or extremely low carb or low fat. But one of the ones that we sort of agree on is what we have is the Mediterranean diet. So this is more of plant-based, so eating more vegetables, restrict your refined carbohydrates, your pastas, your rice, your potatoes, go more for the green leafy vegetables. We like to educate our patients, which is an easy way. Half your plate should be vegetables. Divide the other half in half, where you would have your meat, and the other, which would be a quarter, would be your starches. So some people do better with low carb diets. And so again, talking with your nutritionist who can help you work through your diet is what I generally recommend.
Wonderful. This has been
right.
just incredible. It's passed really quickly. Thank you so much, Dr. Nunlee-Bland. Thank you so much, Lisa Gaunt. We really appreciate all this fantastic information that you've shared with us tonight. And, before we go, I just want to mention Howard University. We shouted out HU at the beginning of the show, but remember they have a special research study that's going on. They've asked me to invite people who listen to the show to participate in a COVID resilience research study. It's voluntary, but if you do fill out just 2 surveys, you'll be compensated up to $100. So if you have any interest whatsoever, please reach out to Dana Harvey. And this is her email, danaharveyresearch@gmail.com. That's DANA Harvey, HARVEY, research@gmail.com. Again, audience, you were wonderful. You asked some fantastic questions. Thanks so much for being part of the Be Health Empowered family. Thanks to Wayne Bruce, Dr. Nunlee-Bland, and Lisa Gaunt for a fantastic show. Remember, we're going to be back next week. And if I don't see you between now and then, remember, be wise, be well, and be health empowered.
guess I should thank the Robinsons. They invited me. They still don't know. I hooked up with Dave 3 days ago. He'll start coughing tomorrow. And I bet in 10 days he'll be on a ventilator. Now, his wife, she's not vaccinated because she thinks it'll prevent her from being pregnant. But what they don't know is that I can decrease sperm count. Sorry, Dave. Good luck with that.